When Kevin saw the family trapped in the crumpled sedan with massive trauma injuries and no way for emergency responders to reach them through the traffic jam, his Army field surgeon training activated immediately. Triage the casualties, prioritize by survivability, begin life-saving intervention with available resources. But his mobile veterinary kit contained only dog supplies, and he had maybe 4 minutes before the little girl bled to death. Welcome to Secret Human Stories. Before I tell you this incredible story of hidden surgical expertise and life-saving operations performed with dog grooming supplies, tell me in the comments what your name is, what country you're watching from, and what types of stories you'd like to see more of on this channel. And if you believe stories like this deserve to be told, hit that subscribe button. Because sometimes the most skilled trauma surgeons are walking golden retrievers through city parks, waiting for the moment when their medical training can save lives that conventional emergency response can't reach in time. 3:47 p.m., Michigan Avenue, Chicago. The intersection of death and miracles. Crash. The pickup truck ran the red light at 45 miles per hour, T-boning the Honda Accord with devastating force. The impact sent the sedan spinning into a fire hydrant, trapping the family inside while water erupted skyward, creating a scene of chaos that would challenge even the most experienced trauma team. Kevin Thompson was walking Mrs. Patterson's 3 golden retrievers when the collision happened 30 feet away. The screech of brakes, the crushing of metal, the sudden silence that follows devastating accidents, all of it triggered memories he'd spent 3 years trying to suppress. Through the spider-webbed windshield, Kevin could see the casualties: driver, male, 40s, unconscious, possible head trauma. Front passenger, female, 30s, conscious but disoriented, probable concussion. Rear passenger, elderly woman, 60s, clutching chest, cardiac distress. Rear passenger, female child, approximately 8 years old, screaming, massive leg trauma with arterial bleeding. The little girl was going to die first. Kevin's military triage training was calculating survival times, arterial bleeding, blood loss rate, shock onset. Maybe 4 minutes before irreversible blood loss. Maybe 6 minutes before cardiac arrest. The ambulance was nowhere in sight, trapped somewhere in Chicago traffic that had gridlocked around the accident scene. Help. Somebody help us. The mother was screaming from the front seat, trying to reach her daughter in the back while trapped by her seatbelt and the collapsed dashboard. Kevin dropped the dog leashes and sprinted toward the wreckage, his hands already moving to his mobile dog grooming kit, the rolling case that contained everything he needed to care for pets during his walking routes. But right now, those veterinary supplies were about to become the only medical equipment available to save a human life. "Ma'am, I'm going to help you," Kevin called through the broken window. "I need you to stay calm and follow my instructions exactly." The woman looked at Kevin with desperate hope. "Are you a doctor?" Kevin's response would reveal everything. "Ma'am, I'm Major Kevin Thompson, United States Army Medical Corps, retired. I'm a field surgeon, and I'm going to save your family." Kevin began the most challenging medical procedure of his civilian life, extracting a family from a crashed vehicle while performing trauma surgery with dog grooming equipment converted into life-saving medical instruments. His grooming scissors became surgical instruments. Pet first aid supplies became trauma dressings. Dog leashes became tourniquets. A battery-powered pet hair dryer became a device for warming shocked patients. Most critically, his veterinary medical knowledge provided the foundation for adapting animal care techniques to human emergency medicine. "Kevin, what are you doing?" Mrs. Patterson was approaching with confusion, not understanding why her gentle dog walker was covered in blood and performing what looked like surgery on accident victims. "Mrs. Patterson, call 911 and tell them we have a mass casualty incident with multiple trauma patients requiring immediate hospital evacuation. Tell them Major Kevin Thompson is on scene providing field medical care." The little girl, Emma Rodriguez, was Kevin's priority patient. The impact had crushed her left leg, severing the femoral artery and creating a life-threatening hemorrhage that required immediate surgical intervention that no dog grooming kit was designed to provide. But Kevin's Army field surgery experience had taught him to perform miracles with whatever materials were available. In Afghanistan, he'd saved wounded soldiers using equipment salvaged from destroyed vehicles, improvised surgical tools, and medical techniques that combined military training with battlefield innovation. Kevin used dog grooming clamps to control arterial bleeding, veterinary surgical thread to suture damaged vessels, pet antiseptic to prevent infection. His hands moved with the precision of someone who'd performed similar procedures under enemy fire, but now he was saving civilians instead of soldiers. "Emma, look at me," Kevin instructed the terrified child while he worked to repair her severed artery. "I'm going to fix your leg, and then you're going to go home and hug your mom and dad. But I need you to be very brave while I work, okay?" Emma nodded through her tears, clinging to Kevin's calm authority that told her she was in the hands of someone who knew how to save her life. The arterial repair took 12 minutes of precision surgery performed in the back seat of a crashed car with improvised veterinary equipment. Kevin's military medical training had taught him to work efficiently under impossible conditions, but this was the first time he'd adapted animal care supplies to human trauma surgery. While working on Emma, Kevin simultaneously directed the treatment of the other family members using techniques learned during mass casualty operations in combat zones. "Mrs. Rodriguez, I need you to apply pressure to your husband's head wound using this towel. Mr. Rodriguez, if you can hear me, don't try to move, you have possible spinal injuries that I'll treat after I finish with Emma." The grandmother, Mrs. Garcia, was experiencing cardiac distress from the trauma and stress of the accident. Kevin administered pet-safe medications from his grooming kit that could also treat human cardiac episodes, using veterinary dosing calculations adapted for human physiology. By the time Chicago Fire Department paramedics arrived 14 minutes later, they found 4 patients who had been stabilized by someone whose medical intervention had prevented what could have been multiple fatalities. Paramedic Captain Sarah Martinez immediately recognized the quality of the medical care that had been provided. "Who administered this medical treatment?" "That man with the dogs," Mrs. Rodriguez replied, pointing at Kevin, who was calmly cleaning blood from his hands while the golden retrievers waited patiently. Captain Martinez examined Kevin's surgical work on Emma's leg and the medical stabilization of the other patients. "Sir, are you medical?" "Army Medical Corps, retired," Kevin replied simply. "Sir, this arterial repair and family stabilization is exceptional emergency medicine. You saved lives with improvised equipment that most emergency departments couldn't have matched." At Northwestern Memorial Hospital, trauma surgeon Dr. Jennifer Kim examined Emma's injuries and Kevin's field surgery with amazement. "Major Thompson, your vascular repair prevented this child from bleeding to death. The surgical technique is textbook perfect, and the adaptation of veterinary supplies to human medicine is brilliant improvisation." Dr. Kim pulled Kevin aside privately. "Where did you learn to perform trauma surgery with animal care equipment?" 8 years Army field surgery in Iraq and Afghanistan. You learn to save lives with whatever materials you have available when soldiers are dying and the nearest hospital is a helicopter ride away. Kevin, have you considered returning to trauma medicine? We need surgeons with your experience in emergency improvisation and mass casualty management. Kevin's response reflected the complexity of his transition from military to civilian life. "Doc, I left surgery because I needed to heal from the trauma of battlefield medicine. But I guess some skills never retire when innocent people need them." 3 weeks later, Kevin received a call from his former commanding officer, Colonel Patricia Hayes, who had heard about the Chicago car accident through Army medical networks. "Major Thompson, I heard you performed field surgery with dog grooming supplies. Outstanding adaptation of military medical training to civilian emergency response." "Colonel, I just used what I learned in the Army to help a family who needed medical care that wasn't available." "Kevin, that's exactly what Army medicine teaches: adapt, improvise, and save lives using whatever resources you have. You honored our medical mission even after discharge. Now for the background that made this veterinary supply miracle possible." Major Kevin Thompson had served 8 years with the U.S. Army Medical Corps, specializing in field surgery and trauma medicine from 2012 to 2020. His military medical training included advanced trauma life support, battlefield surgery, emergency medicine, and mass casualty management under combat conditions. Army field surgeons are trained to perform complex medical procedures in resource-limited environments where conventional hospital equipment isn't available. Kevin's specialized training included surgical improvisation, medical supply adaptation, and the ability to convert non-medical equipment into life-saving medical devices. During his military service, Kevin had performed trauma surgery in field hospitals, forward operating bases, and mobile surgical units throughout Iraq and Afghanistan. His medical record included 234 successful trauma surgeries, 67 mass casualty responses, and a reputation among infantry units as someone who could save lives under conditions that would overwhelm civilian emergency medicine. But Kevin's specialty had been what Army medics call resource adaptation surgery, performing advanced medical procedures using improvised equipment, non-medical supplies, and techniques that combined military medical training with battlefield innovation. These skills were essential when treating wounded soldiers in locations where conventional medical equipment was damaged, unavailable, or inadequate for the medical challenges being faced. The psychological demands of battlefield medicine were extraordinary. Every wounded soldier Kevin treated represented someone whose survival depended entirely on his surgical skill, medical judgment, and ability to perform complex procedures under conditions that would challenge the best civilian trauma centers. Kevin's transition out of military service in 2020 had been difficult. PTSD from combat medical operations, survivor's guilt from soldiers he couldn't save despite perfect surgical technique, and the challenge of finding civilian work that utilized his medical skills without triggering combat-related stress responses had led him to seek employment that provided healing without the life-or-death pressure of surgery. Professional dog walking had seemed perfect. Caring for animals instead of treating traumatic injuries, walking through peaceful parks instead of running through combat zones, and providing companionship instead of performing surgery. For 3 years, Kevin had convinced himself that his military medical skills were unnecessary artifacts that had no place in his new civilian identity focused on animal care. But some training never truly retires, especially when it involves saving lives in emergency situations where conventional medical support isn't available. The car accident had created exactly the kind of medical emergency that Kevin's Army field surgery training had prepared him to handle: trauma care using improvised equipment in a resource-limited environment where patient survival depended on medical improvisation. Kevin's story teaches us that military medical training creates lifelong healers who carry their life-saving skills wherever they go, even when they're trying to build peaceful civilian lives focused on animal care rather than human surgery. The Army field surgeon who once saved wounded soldiers with battlefield improvisation found a way to use his medical expertise to save a Chicago family using dog grooming supplies. 6 months after the accident, Kevin received a letter from Emma Rodriguez that would change his understanding of his post-military purpose. "Dr. Kevin," Emma wrote in her 8-year-old handwriting, "thank you for fixing my leg when it was broken. Mommy says you're a hero who takes care of dogs now. Can you teach me how to take care of animals too?" Emma's letter helped Kevin realize that his transition from military to civilian life wasn't about abandoning his medical skills, it was about using them to create healing in communities where his expertise could protect both human and animal life, where his surgical knowledge could serve peaceful purposes instead of battlefield necessities. Today, Kevin Thompson continues working as a professional dog walker in Chicago, but now he also serves as a volunteer emergency medical responder who trains civilian first responders in medical improvisation techniques. His clients know about his Army medical background and appreciate having someone whose surgical expertise provides emergency capabilities that conventional pet care providers cannot match. Kevin's story demonstrates that military medical service doesn't end with discharge. It evolves into civilian medical readiness that can save lives in situations where conventional emergency services are delayed or inadequate. The Army field surgeon who once treated wounded soldiers in Afghan field hospitals found a way to continue saving lives on Chicago streets, using his skills to protect families instead of fellow warriors. Sometimes medical service means performing surgery in military field hospitals while artillery shells explode outside. Sometimes it means walking golden retrievers through city parks while staying alert for medical emergencies. Sometimes it means using military surgical training to save accident victims when ambulances can't reach them in time. Kevin Thompson learned to provide all three forms of medical service, honoring both his identity as a warrior surgeon and his calling as someone who cares for both animals and the humans who love them. The dog walker who used to be an Army field surgeon became the community medical volunteer who still saves lives when accidents happen in places where his surgical improvisation can mean the difference between families living or dying while waiting for conventional emergency response. American families and their pets can live peacefully knowing that warriors like Kevin Thompson have traded their military surgical instruments for dog leashes and grooming supplies but never surrendered their commitment to saving lives when medical emergencies require the kind of expertise that only battlefield medicine can provide.